Hi guys, Heather here again. Sorry for this hideous looking room. This is, my bedroom. It's old. We live in an old house. So, as you can see, my hair is definitely different than it was when I talked to you on Monday. That's because my son and I went and got our hair cut yesterday. He got an awesome mohawk, and I went back to this pixie cut that I had 6, 7 years ago. Um, Trying to get used to having little hair before I have to get used to no hair. Still looks funny looking at myself, but still me, I guess. So there's two things I want to talk to you about. One is how I'm feeling since the chemo on Monday. Today's Wednesday. Um, so chemo on Monday, as I said during the last video, went pretty smoothly. That night, I definitely felt tired. Tuesday, I was exhausted and very nauseous. Um, Tuesday, I probably took an hour and a half nap that morning, and then I ended up still tired by 4:30 in the afternoon, maybe even earlier. Um, hmm. Yeah, so the nausea has really not gone away. And excuse me, because it also means that I keep burping. But so the nausea seems to be a bit better with not with the Zofran that they gave me, but when I eat like ginger. So ginger is definitely very calming for your stomach. I don't know exactly what's in the ginger that does it, but it helps. So using cooking with ginger definitely helps. For lunch, I had a soy ginger noodle bowl, and that was definitely better. My stomach felt better after that. In the morning, I made oatmeal, and I make what I call snickerdoodle oatmeal. So if you like snickerdoodle cookies, I suggest this. So I have quick oats. Then I sprinkle in a good amount of cinnamon on top, a tad bit of nutmeg, and ginger. Ginger, I mean, go as much or as little as you like, I guess. The more you put in, probably the better it will help. Then you put in the hot water, stir it up, let it, cook the oats a little bit in the hot water, and then add in about a tablespoon of peanut butter. You may or may not have to add more water depending on your consistency. Um, this is not only good because of the ginger, but oats are good for you. The peanut butter has protein, so if you're going to be eating something, it's good to get some protein into you. And I just make a small amount at a time and eat slowly. So the other thing that's helped with my nausea is this thing that my friend gave me. So a friend of mine uses oils. Let's see. There we go. Now you can see it. So it's Digest. I'm not sure exactly how you pronounce it, but it's to help with an essential oil, mix of essential oils to help with your digestive system. She uses it when she's not feeling well, has a little bit of nausea. Obviously, when you have a stomach bug, excuse me, not the same as, the nausea that you're having from cancer, from the chemo treatments, but there's two different ways you can take this. One is to ingest it. You just need a drop. The other way is to put like 4 or 5 drops on your stomach and rub them in. Now I have to say I have not ventured into the trying of ingesting it. That's the way my friend does it, and she says she just drinks something else afterwards and it gets rid of the flavor real fast. I do not like the smell in the bottle, so oh, there goes my dog. Brady, stop. I'm not a real fan of this smell, but on my skin, it doesn't bother me so much. So I feel like it actually has helped me. And I like have the smell a little bit on my hands, and I feel like that smell is kind of calming as well. So if it calms me, maybe it's gonna make me less nauseous. My other side effect, I have to say, is definitely being tired still. And unfortunately, when I'm tired, I'm a bit irritable. I think we all are. So unfortunately, I think I snap on my fiance a few times in the last day or two. I hope he understands and realizes how much I appreciate him. But yeah, it definitely does make the tired feeling definitely does make me irritable. I want to say by 3:30 today, I was feeling pretty tired. I do work for myself. I own my own photography business, so luckily I am my own boss, and um, I understand what I'm going through. Um, so I did go back to work today, and I'm normally closed on Monday and Tuesday. So Wednesday through Saturday I'm open. Sunday during the holidays or by appointment. And it was a long day. I definitely needed to go in to get caught up on things, but definitely feeling tired. Um, so I guess those are that's really what I wanted to talk about how I'm feeling since the chemo. The only other thing that I wanted to talk to you guys really about today is some people have said, you know, tell your friend or, to other people that she should read this or research this or that. And let me tell you, I always thought if I was to have cancer, I would look for alternative methods. I would not want to go through chemo. Who wants to poison their cells just to get well? It doesn't make sense at all. But I've chose to do that because the chemo has a very high rate of curing this disease that I have, the non-Hodgkin's B-cell lymphoma. That's the aggressive form of it. So it has a very high cure rate. So that's one reason right there. Two, all those other alternative methods at this moment are not tried and true. Some of them are, yes, having good results in clinical trials, but I don't feel that it's, the proper method at this moment. The other thing is my lymphoma at this time is not going to kill me. However, the mass in my chest is so large that the complications due to that size could kill me. So the mass, as I've explained, was 7 inches wide, 10 inches tall, 11 inches deep. 11 inches deep, 3 inches deep. And it's pushing on my superior vena cava, which is one of the main arteries in my, to your heart. It pushed on my sternum. It's pushing on my spine. And it's putting pressure on my lungs. So I don't really want to have a heart attack. I don't really want to stop breathing. And I don't really want to have my spine snap. So those are my reasonings for choosing to go with the chemotherapy at this time. So, to each their own. Like I said, I always thought I would search out alternative methods. And unfortunately, those alternative methods are not where they need to be at this moment for me to go for them. So that's all I have to say for today, and I will talk to you all soon.